Welcome to the Probate Nation. My name is Richard Ruddy. We continue tonight our discussion about Medicare, Medigap, and Medicare Advantage decisions that most seniors face as they get close to age 65. The show tonight details the common and costly Medicare, Medigap, and Medicare Advantage mistakes often made, compares the cost of these plans, discusses the advantages and disadvantages of each plan, and provides tips to save money with any Medicare health care plan you select. We are pleased to have returning as our guest the owner of the Medicare Coach, a firm that provides independent advice to seniors and their advisors on how to get the most out of Medicare coverage. She also runs a Medicare concierge and boot camp program to educate folks on Medicare options, pitfalls to avoid, and tips on decisions to be made. She's a graduate of the University of Kansas, the home of basketball, by the way. And prior to her work for the Medicare Coach, she worked as a risk manager for Goldman Sachs. Please welcome back Emily Gang, president of the Medicare Coach. Hi, Emily. Thanks for coming back.
Yeah, thanks for having me, Richard. It's great to be here.
I tell you, man, Jayhawks, you just love that. I just was so excited to see that you were a Jayhawk fan. Well, look, let's talk about, kind of review for folks very quickly. What are the medical benefits? What medical benefits does a traditional Medicare plan cover?
Yeah, good question. So Medicare Part A and B are kind of the main Medicare benefits. They cover hospital visits, they cover hospice, they cover some skilled nursing, they cover your doctor visits. Basically, they cover anything that's medically necessary when it comes to your health care.
So in contrast, what medical benefits does a Medicare Advantage plan cover?
Yeah, good question. They're actually required to cover the exact same benefits. So the coverage that they provide is the same no matter which program, which path that you take, but it can determine or can differ in terms of which doctors you can get care from, depending on which plan you're on. Advantage plans sometimes have extra things like extra vision benefits or dental benefits, maybe drug coverage, maybe meal services in certain situations, but at a base level, they're going to cover the exact same benefits no matter which path you go down.
Okay. So Emily, let's turn to, again, the review. How does the cost of traditional Medicare compare to the cost of Medicare Advantage plans?
Yeah, great question. So no matter which path you go down, you have the same Medicare Part A and B monthly premium. So that doesn't make a difference. Where the cost difference really comes in is kind of the premiums of either the Medicare Advantage plan or the Medigap as well as the Part D plan. So Part D plans, at least for 2022, on average range around $33 a month. It can be as low as $5 a month or even more than that if you have expensive medications. And Medigap plans range anywhere from about $20 a month to $100 to $200 a month. So we kind of have those higher premiums on Medicare Advantage, but with original Medicare, with that Medigap and that Part D plan. But we have a lower total out-of-pocket costs when we're on that traditional Medicare route. On the other hand, with Medicare Advantage, premiums can be low as $0 or as high as a couple hundred. The key, though, with Medicare Advantage is that the out-of-pocket costs tend to be a lot higher than on the traditional Medicare route. So when you're on Medicare Advantage, those out-of-pocket costs can be as high as around $7,000 a year for in-network doctors and even higher for out-of-network doctors. So my point is this: premiums tend to be higher on the traditional Medicare route, and premiums tend to be lower on the Medicare Advantage route. But when you think about total cost when it comes to your healthcare, it's usually a lot lower when you're on the traditional Medicare route rather than on Medicare Advantage.
Okay, so let's talk about, I know that we in our initial program, part one, and I know that we've talked in preparing for the show, the challenges of avoiding some of the common mistakes that people occur. So in Medicare coverage selection, what are some of the common mistakes you see people make?
I think one of the things is that people don't realize what Medicare plans or doctors see. So they tend to make a Medicare decision based on an advertisement from an insurance company or their agents, and they're not really understanding how their doctors do or do not accept certain plans. They also don't necessarily consider even their current health insurance, and if they have other options, retiree plans, employer plans, things like that, and how that also impacts their Medicare decisions. But again, I think a lot of people don't understand the actual fundamental rules of Medicare. They simply just buy a plan. It's not their fault. But that can lead to a lot of mistakes if you don't realize that there's more to Medicare than just buying a Medicare plan.
So, and that kind of leads us to, as we sort of drill through and think through that, if someone has a retiree plan or an employer plan or any other health insurance options, should they delay Medicare?
Yeah, great question. So Medicare rules say that you can delay Medicare past 65 without penalties as long as you have an employer health insurance plan which meets Medicare rules. So if you have an employer plan that meets these rules, it can be your employer or a spouse's employer. There are ways to delay Medicare past 65. And in those situations, if your employer plan is cheaper than Medicare, you should delay Medicare, okay? But there are times too where actually Medicare is a better option than an employer plan. So it's worth comparing the numbers, comparing the rules so you're not, again, overpaying for health insurance or getting penalized later on. Now, when it comes to retiree plans, most retiree plans do require at least Medicare Part A and B as your primary health insurance. And by doing this, it actually saves that retiree plan millions, billions of dollars every single year. So it's so important if you have a retiree plan to, one, understand what are the Medicare rules, right? Is Medicare required to be primary or not? I think the second thing to be aware of is your retiree plan actually a good plan? There's some really great retiree plans, whether it be TRICARE for Life, CHAMP VA, Federal Employee Health Benefit plans, things like that. But there are other retiree plans that are not great, whether you are at a corporation or maybe at a union of sorts. But it's so important to look at your options and make an informed decision, and don't just assume that one is better than the other.
So, we worry about picking the wrong Medicare plan. How do I determine if I picked the wrong plan?
Yeah, great question. And I think the most important part, which I walk my clients through, is let's understand what's important to your healthcare. What doctors do you want to see? What medications do you take? How much risk do you want to take? Again, do you want to have a really large out-of-pocket amount, or do they have a smaller amount? But just really understanding the fundamentals of healthcare, of health insurance as well, and to make sure that everything is lined up when you first join Medicare, because again, it can be hard to switch in the future.
So, and then the last thing I think in this sort of discussion has to do with understanding the insurability rules. Is that a mistake that comes into play here in making this decision?
Absolutely. So we all think of the news around the Affordable Care Act, which basically said that, pre-existing conditions can't restrict you from having health insurance. But Medicare is a little bit different. And while most parts of Medicare do have those same rules where they have to accept you, there is a rule within Medigap plans, which basically say that when you first join Medicare, you can join any plan that you want, no matter what your health history is. But once that 6-month window expires, at least in most states, it's really hard to either join a new Medigap plan or to switch letters or companies. And so people assume they can just join Medicare when they're healthy, they're young, they're 65, everything is great. They just assume they can just switch later on. That's a huge misconception. If you're not quite sure, if you're not aware of the fact that you can't switch in the future, you make a decision very, very differently. And the clients that I have come to me who are in a bad spot are usually the ones who didn't realize how hard it can be to go back to traditional Medicare with that Medigap plan in place.
Well, that is a source of some concern, because obviously people's medical conditions and needs change over time. So they may go in thinking that they have the right plan, and they may have the right plan, and then their situation changes, and it sounds like they're kind of in a bad spot. So, well, let's go ahead and take a look now at some of the issues related to, as we talked about, switching plans. Okay, we're talking about switching plans. Let's just begin with, can you switch from traditional Medicare to Medicare Advantage plan?
Great question. It is very, very easy to switch from traditional Medicare to Medicare Advantage, as long as you do so during an approved period, which is usually the October 15th through December 7th period of time. Advantage plans are required to accept you no matter what your health history is. So it is very, very easy to join or to switch to a Medicare Advantage plan, or even switch between different Medicare Advantage plans as well. Again, it's very fluid on that side of the Medicare space.
So on the other, to sort of flip it, let's say I've gone into a Medicare Advantage plan and now I just decide I want to go back to traditional Medicare. You started to talk about that a little bit earlier, but is that possible, or is that something that's not going to be possible?
Yeah. So in New York State, it's really easy to do so. And the reason is in New York State, you can join any Medigap plan no matter what your health history is. But all the other states, in order to go back to a Medigap plan, you have to, again, prove that you're healthy. So my point is this: if you're on Medicare Advantage, you already have Medicare Part A and B, so that can easily, again, become traditional Medicare. But what you can't get necessarily is that Medigap plan. And what I find people usually, and that Medigap plan, right, covers 20% of most of your medical expenses. I find that most people want out of Medicare Advantage and then want to go back to original Medicare when they have health issues. So I have spouses of dementia patients, or I have people who have cancer, or whatever it might be, realize that they want to be back over here. But the problem is that we can't get them a Medigap plan, and they can't afford that 20% of Part B that Medicare does not cover. And so that's really the hard switch. It's really hard to go back that way for the financial reasons, as well as for these Medicare rules.
So do you see people moving to New York in order to be able to get into a Medigap plan to get back in the system?
We haven't seen it, but I mean, maybe someone in New Jersey or Connecticut or somewhere nearby would make that switch. We don't see people moving states for that reason. I think it's just why I'm so passionate about getting Medicare right the first time, because if you do it right the first time and you're informed of how it works, you can avoid having to move to New York State to use their rule.
Okay, good point. Good point. Now, can you switch? I'm in a Medicare Advantage plan. Can I switch to a different Medicare Advantage plan?
Absolutely. And that main time to do that is from October 15th through December 7th. So again, if your doctor's changing Medicare Advantage plans or your medications are changing, it's really easy to switch between different Medicare Advantage plans during approved periods.
And there's no medical underwriting involved with the switchover?
Correct, not with Medicare Advantage.
Okay, well, that's good to know. Well, I have one more question before we go to tips to save money. Do you find that husband and wives have different plans?
Usually, yes. Usually, though, they're either both on Medicare Advantage or they're both on the traditional Medicare route. So that usually is common. But most of my clients who are couples will end up on different Medicare plans because they have different doctors, different medications, different health concerns, all of those things.
Sure, that seems to make sense. That's why I asked that particular question.
Yeah.
Well, let's talk about, everybody wants to learn wants some tips to save money. So tell me, what are your suggestions? How do we save money on Medicare Advantage or traditional Medicare? What do you recommend?
Absolutely. So to that point, I mean, once you're on Medicare, there's only so many changes that can be made. But there are some really important money-saving changes to look at every year, again, from October 15th through December 7th mainly. And that is reviewing both your Medicare Part D drug plan as well as your Advantage plan. Especially your Medicare Part D drug plan if you take medications that are even somewhat expensive. On average, our client, at least last year, saved over $1,000 by changing Part D drug plans. And that's a lot of money, especially when you're on a fixed income. And so there's so many changes that are happening every single year when it comes especially to your medications, that by simply watching those costs, you can save yourself a decent amount of money, which I think is a really nice thing to have.
That's important. Now, are there any dementia-specific benefits for Medicare or under Medicare Advantage plans?
Absolutely. So there are some special need Medicare Advantage plans out there that can provide some extra benefits for dementia patients. And so I think it's worthwhile to see, one, does your zip code even offer you a special needs plan? And if so, does it actually fit you well? I think the other thing is that there can be qualifying events when you move into or out of a nursing care facility that can allow you to make Medicare changes during the year. Medicare plan changes, especially between Advantage plans during the year. I think it's important to look at that because a lot of those nursing care facilities have deals with certain pharmacies, and by simply even just aligning your Medicare plan with the pharmacy at the skilled nursing facility or at the nursing care facility, it can be a huge cost. One of the women who works for us, her mother is in a facility, and she saved $5,000 by just changing Advantage plans to align with the pharmacy that they were using. So it's important to look at those things.
Now, do do both the traditional Medicare and Medicare Advantage plans provide for covering a neuropsych evaluation if someone needs to be evaluated for dementia?
Absolutely, they both should. Absolutely. Again, Medicare covers anything that's medically necessary. And so if your doctor proves it to be medically necessary, then yes, it will be covered.
Okay, that's a good point. We see a lot of that with patients that are, part of a conservatorship or guardianship proceeding, and we want to get to have a neuropsych evaluation done. We tell them they have to get a doctor's a referral to the neuropsych, but then that you should be paid by Medicare. So that's good to know. That's good to know. Okay, let's go talk now about pitfalls and recommendations. Okay, so what are some of the common pitfalls that you see? All these different plans and what people do and what they don't do as they begin to make these sort of critical decisions in selecting their Medicare coverage, whether it's Medicare traditional or Medicare Advantage.
Absolutely. So I think one of the pitfalls goes back to an earlier point of not understanding that doctors don't take all Medicare plans. And so it's really about being clear about, based on the healthcare that you want, understanding what Medicare is or is not accepted. I think another huge pitfall, again, is not understanding the ability to switch between the two programs, especially switching back to traditional Medicare from Medicare Advantage. And so I think that I could go on for hours about stories of people who've come to me with their mistakes, but whether it's, again, not realizing their doctors, not realizing they can switch in the future, joining Medicare too early before they leave an employer plan, being on COBRA. People think that COBRA meets Medicare rules and it doesn't at 65. And so there's a lot of maybe not the word's not legality, but there's a lot of Medicare rules that are created in the system, and people easily overlook that, which again creates issues in the long run. I think especially with Medicare Advantage, I see more people regret joining a Medicare Advantage plan because they didn't really understand how the program worked when they first joined Medicare. Again, around the networks, around the ability to go back, around the medication costs, things like that. And so I think it's so important for people not just to be sold a Medicare plan. There's so much more to Medicare than just picking out a plan in a company. Again, there's so many rules that the government has set up, and unfortunately the government doesn't have the time or the resources to really help people understand how it works. But I think it's so important to understand what the Medicare rules are so that you can make a decision that fits you both now as well as in the future.
Yeah, that's it's a challenge because what their health's like and what their needs might be 5 or 10 years from now, who's to say? So it is a challenge. But how about we're going to turn now to get some of your final thoughts and words of advice for folks as they begin to face these decisions, or otherwise are thinking about how they can change the decision they made already. Can you share some thoughts about that?
Absolutely. I think a lot of people assume that Medicare is bad health insurance. And so I see people putting off retirement because they don't want to be on Medicare or whatever else. The reality is that Medicare can be really, really good health insurance if you do what's ultimately right and best for you, and you understand, or at least you're guided through the system to get the most out of the benefit. So I don't want people to be afraid of Medicare. You can still get really good health insurance through Medicare if you do the right things. And by doing the right things, it's important to understand these insurability rules, right? When my dad was joining Medicare, right, and figuring out what to do, we needed to understand the fact that because of these insurability rules, we might not be able to make changes in the future. So if you go into it with eyes wide open and understanding the rules, again, you can be pleasantly surprised with Medicare. And I also want you to start early. When people come in to me, the month before they turn 65, the month before they join Medicare, we've missed a lot of time. We've missed a lot of things that could be happening well in advance to help people easily move on to Medicare and to help people easily, again, make that right Medicare decision and not get overwhelmed with all the phone calls or all the pamphlets that are coming to you from insurance companies. So ideally, people do start their Medicare decision about 6 to 9 months before they want their Medicare to start. Sometimes even earlier if you have a lot of health issues. But again, if you're proactive and you're thoughtful, there are things that you can do to both, again, save yourself money, save yourself time, and be 100% confident in your Medicare decision. And I feel like I'm a broken record on this one, but also please, everyone should be reviewing their Medicare Part D drug plan every single year, whether it's for you or your loved ones or your clients. But again, there's so many changes that are happening in that medication coverage that by simply paying attention to that, you can free up a lot of money and avoid a lot of unnecessary surprises in the upcoming new year.
That's all great information. So I tell you, Emily, thank you so much for taking the time to visit with us. And again, to come back for part 2 and drill down into more detail about the things that people should and should not do. Really great information, super valuable, going to save people a lot of money if they pay attention and follow along with some of the advice you've given. So great public service, and I want to express my appreciation again for coming on the Probate Nation.
Thanks for having me, Richard.
You are very welcome. You know, folks, over the course of these 2 shows on Medicare, Medigap, and Medicare Advantage plan decisions, you have been treated to some really outstanding information, some tools, insights, and recommendations on how to manage this critical care coverage decision as you turn 65. Clearly, no one plan is right for everyone, and there is much to consider before a good decision can be made. The key concern I continue to have, and I've expressed it before, is that the decision is very complicated. There are many moving parts. It seems to me that it would be wise to sit down with someone familiar with Medicare rules and options who can help you make a good decision for you or the elderly person you are responsible for. I encourage you to get that advice. This brings us to the conclusion of our show. I hope you found it helpful. Until next time, you take care, live wisely, and be safe out there.